Qatar Hospital in the heart of Orangi town is the only public health facility in the district. 5 years ago, in a joint venture with international donors, the provincial government of Sindh set up an emergency obstetric care unit. The unit provides inexpensive, accessible health care to local women.
Delivered, normal.
An important initiative at Qatar has been the founding of a midwifery school. The school provides formal training to local girls and pays a small stipend. The plan is for these girls to replace the dyes in the area and encourage women to deliver in the safety of the hospital. For most girls, it's a chance to find acceptable work in a highly conservative community. But for local dyes, the young qualified midwives are threatening their livelihoods.
अपनी रोजी के लिए हर कोई चाहता है कि बेहतर हो, लेकिन हम ये कहते हैं कि जो आजकल की midwives हैं, नर्सें हैं, इनको तजर्बे नहीं है। ये तो मैं हॉस्पिटल के अंदर बैठ कर कह सकती हूँ कि आप लोगों को तजर्बा नहीं है। ये सिर्फ कलम चलाते हैं, कलम के ज़रिए काम करते हैं। हम अपने इन उंगलियों के तजर्बे से करते हैं। हमारे तजर्बे में ये हॉस्पिटल के अंदर कोई डॉक्टर या नर्स ये कहा कि मैं तजर्बे से आ गया हूँ, नो, बिल्कुल नहीं ऐसा हो सकता। मैं चैलेंज से कहती हूँ इनको कि आओ मेरे सामने करो काम।
The problem has to be realized in its full potential. The problem, people don't even know, they don't even accept that this is a fact that there are so many women unnecessarily dying in this. They think it's routine. This is what the feeling is everywhere, that women do die in childbirth, and it's very, very easily accepted. Once the problem is realized, then if the sensitivity is there, if the motivation is there, then I think that's the first step.
Dr Shah is a former student of Shershah's and resident gynaecologist at Moshad Hospital, a fully equipped private health facility situated at the border of Sindh and the poor desert province of Baluchistan. Maternal deaths here are some of the highest in Pakistan.
Right from the very beginning, this patriarchal society, male-dominant society, and women are comparatively a lesser being. Women living at hardly a kilometer away will not come here until and unless they are severely compromised. The patient that I operated on this morning, whose uterus I removed, her father-in-law is just now saying that we cannot afford any more drugs, anything else, let her die.
There is no importance of women's health as such. The concept is not there.
The low status of women in Pakistan reflects from several socio-economic indicators. Adult literacy for women is half that of men. More girls die between the ages of 1 and 4, and female mortality rates are 12% higher than their male counterparts. Significantly, more than half of all lactating women are anemic or malnourished.
And because of lesser education, people don't ask for more. They are not aware of their rights, and they are not aware that they have to demand all this. Nobody is going to present to them these things.
The whole idea is not to make the girls independent. Any girl who becomes more independent or highly educated is still considered not a liability, but it's a kind of warning that she may not be able to adjust in our society.
At Qatar Hospital, patient attendance is rapidly increasing as more women take advantage of heavily subsidised drugs and professional obstetric care.
I mean, it's our experience all over the country that whenever you start service and whenever the service is available, people will come. The everyday number of the patients are increasing, and we are shortage of resources. And government is not prepared to provide you the drugs and everything which they should. So you depend on the donors, and the donors are exhausting.
Generally, things have not improved much because very little money is being spent in the social sector.
Anis Haroon is another activist fighting to address Pakistan's maternal health crisis. She is president of the Aurat Foundation, one of the leading organisations for women's rights in Pakistan.
Unfortunately, we had more than this democratic rule. We have been under the military rule. You know? And their focus was on defense. Their focus was on the welfare of the army. And so every year, in every budget, we are spending less and less on the social sector. That means education, health, and creating job opportunities for women.
In the end of the day, everything boils down onto the empowerment of the woman and the woman's status in the society. If society do not consider woman as human being and is not ready to give rights to the woman, then society is not ready to give her treatment also.